Our next speaker, our next company will be Prime for no, I'm sorry, Kinesis Health Technologies with Barry Green. Sorry, and the floor is yours.
Good morning, everybody. Can you see my screen okay?
Yes, perfect.
Okay. My name is Barry Green. I am co-founder and Chief Technology Officer at Kinesis Health Technologies. We're a digital health company. We focus primarily on assessment and monitoring of physical function, in particular gait, balance, and falls risk. We were founded in 2013. We're a medical device manufacturer and we have customers in 13 countries around the world. So I'm just going to focus on one use case that we think is relevant, which is falls in older adults and how we support remote and unsupervised monitoring of falls in the home. So falls are a major global and societal problem. 1 in 3 over 65s falling every year. 95% of all hip fractures are caused by a fall, and 1 in 3 of those people experiencing a hip fracture never return home, and 1 in 5 die. In the US alone, falls cost $50 billion each year, and in the EU, it's $25 billion. This is important because falls aren't inevitable, and there's been a lot of research has shown that if you can identify those people at risk of falls early and intervene, as well as track them in an ongoing fashion, you can reduce falls by up to 50%. Traditionally, falls are managed using subjective clinical scales, and these rely on experienced professionals, and it's really difficult to scale them. And then with the rise of COVID-19, there's been increased difficulty in getting older people to healthcare facilities or in receiving care at home. So this kind of drives a need for unsupervised care at home. So current approaches are reactive rather than preventative, and they don't really integrate health assessment data and intervention across services, and it tends to be spread between health and social care. But really this means that older adults aren't really at all empowered to take action to monitor their risk and stay healthy, and they have very little information about how to manage their own health in this regard. So Kinesis have developed a variety of solutions across fall prevention, but also rehabilitation. But we have a 4-step program where we screen, assess, intervene, and monitor patients. So this is managed, first of all, by an online screening tool, which allows an older adult to monitor various clinical risk factors for negative outcomes. And based on machine learning algorithms that we built into this platform, we can automatically then refer them for clinical assessments. And we have wearable sensor-based assessment tools for assessment of falls risk, gait, mobility, and balance. And then we also, which is probably most relevant for this audience, we also offer smartphone tools that use the sensors embedded in the smartphones along with machine learning algorithms to assess falls risk, balance, and physical function unsupervised in the home. Based on the level of risk that a patient has, we can then automatically tailor intervention programs based on their personalized inputs. So exercise interventions and other clinical interventions that can be managed remotely. So our tool that I'm going to focus on here is Kinesis Balance, which is a smartphone application. It supports remote assessment of physical function. So as I said, it uses the sensors in the smartphone as part of a periodic balance test. And then it also offers tailored, personalized fall prevention and exercise interventions. So it's based on 13 years of peer-reviewed research, and it offers a precise measurement of standing balance using validated machine learning algorithms. The data are then stored securely on our cloud and can be integrated if need be, and the content can be customized. So we would offer customers customized versions of the platform that may target different conditions or may want to include other clinical information that we can then analyze and display back to the patients and to the consumers. So the benefits are that the app can engage and empower older adults on falls. It facilitates self-assessment unsupervised in the home, and it can track function and falls risk over time. This means that it's very easy to scale up because it's based on bring your own devices, and it's a class 1 medical device in the EU and in the US. And this is important because it drives primary prevention. So essentially, it allows us to remotely monitor patients in the home and to increase the quality of care that is delivered in the home. So thank you very much for your time, and I look forward to seeing if we can potentially work with the ROSIA group.